Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barua. The third wave of COVID is likely to hit the country at the end of August, and the chances are that it won't be as intense as the second wave. This is what the ICMR has told NDTV in an exclusive interview. Now, the IMA has also warned that a third wave is inevitable, it is imminent, pointing out that in many parts of the country, both the government and the public have been complacent. There have been mass gatherings, large crowds, and COVID-appropriate behavior hasn't been followed. The two states of Maharashtra and Kerala are seeing a rise in daily cases. These are the two states that are reporting the biggest spike in terms of their daily cases. Many believing that these are the two states that will largely trigger the third wave of COVID. Now, the World Health Organization chief has also warned that globally also we are at the early stages of a third wave of COVID. They say this is largely driven by the Delta variant. If you look at that curve on your screens right now, you can see that the bell-shaped curve clearly points out that globally cases are rising. Now, the question is that given the slow pace of vaccination here in India, how prepared are we to deal with the onslaught of the third wave? Can we be sure that it won't be as devastating as the second wave? And now that we're foreseeing it, and there are so many predictions about the fact that a third wave is inevitable, it's going to come, globally we're already seeing the pattern emerge, what do we need to do to prevent it? Should India start locking down areas that have been unlocked? What really is the best strategy to adopt? We have Dr. J.A. Jayalal, the president of the Indian Medical Association, joining us on the broadcast. We also have Dr. Chandrakant Laheria, an epidemiologist and health system specialist. Dr. Laheria, to you first. The warning signs are all there. Whether it's, whether you look at what's happening globally, whether you look at what's happening in the UK or Brazil, or even the warnings that have been issued internally here in India. The question, therefore, is what needs to be done? And can we be sure that the third wave won't be as severe as the second?
So we need to remember that any rise in the case is dependent upon four factors. Two modifiable by individual and two cannot be modified that much. The modifiable by individual and policymakers are the COVID appropriate behavior, which we determine, and also the vaccination rate. That if we can step up vaccination, we can slow down the number of cases. There are two other non-modifiable, which are how the natural immunity will wane off or decline over a period of time. And second is which variant can emerge. Since we cannot do much about waning of immunity and emergence of variant, the only approach we have, either we increase the vaccination rate or adopt COVID appropriate behavior. We know that our vaccination rate is not to the pace. The only thing which is left is that COVID appropriate behavior is followed by people. And we know that people are not following that. And that's why people have said that earlier we were saying that third wave would come in November, but now looking at the vaccination rate and looking at the COVID appropriate behavior not being followed, it is very possible the next wave can come earlier. And the global evidence is emerging that on 21st June, there was 370,000 daily cases, 7-day average global level, and now that has gone to 470,000. So it is increasing at global level. Delta variant has affected 110 countries. And we need to remember that we need to look at the wave at three levels: local level, that at district and states, national level, and global level. And all levels there is evidence that cases are rising. As long as virus is circulating, we cannot vaccinate people and people are not following COVID appropriate behavior. This is really risky and we need to recognize that. And that's what exactly World Health Organization has said, and we should be aware that that's what the policymakers are talking now.
Dr. Jayalal, what more needs to be done? We've identified the states, and in fact we're putting up that map on our screens right now, the states which are reporting the highest number of cases. We also have identified the 6 states which are reporting a larger percentage of COVID-19 cases as compared to the rest of the country. Having all of this knowledge, having the foresight that a third wave is inevitable, what needs to be done? Because it doesn't appear, neither is the pace of vaccination accelerating, and nor are we locking down these areas.
Yeah, we are in a very critical situation now. We are almost at the end of the second wave, but we are not yet over the second wave. The third wave is inevitable. But we know for sure, as already has been discussed, what are the ways and means by which we can go through it. Right from the beginning of January, we are talking on the vaccination drive to be in a larger speed, and the war foot has to be done. Due to the logistic supply, it is not happening at that fast pace. but still the government is confident that they will be able to supply still more vaccine and we can augment the vaccination drive. That is on one part. But second part, we must also know just wearing a mask, an appropriate mask, is going to stop 70%. Just like what the vaccine, when you are getting a vaccine, you are 70% protected.
Yes.
Equally, when you are having a good mask, that is 70% protected. So it is a responsibility of all the stakeholders. The government should also ensure, but also the public. We are all grown-up people, we are all learned people, and the society, there is a lot of areas where the people should come forward, organizations should come out to build awareness on the people to necessarily wear the mask if that all are coming out, and at all level, a containment or the lockdown has to be there. I will not be suggesting a national lockdown, but at least on the local level, the self-lockdown of the people or the local village lockdown has to be implemented to ensure that this is not spreading.
What we've established is that the warning signs are all there, whether it's the R factor, the low rate of vaccination, the 6 states where cases are accelerating more than the rest of the country. All of these are warning signs that are, in a certain sense, telling us that the third wave is inevitable. It's likely to hit sooner than anticipated. Now, interestingly, world over, there is a rise in COVID-19 cases and a very specific warning that the World Health Organization has issued about the Delta variant of COVID, which we know is more transmissible. The EU Medicine Agency, for instance, has warned that 90% of all cases in the EU by the end of August will be the Delta variant. Furthermore, what we've been warned is that you need 2 doses of the vaccine in order to better protect yourself against the Delta variant. The European Medicine Agency, for instance, has even suggested vaccine mixing to deal with the vaccine shortage. Now, let's put this in perspective for our viewers. India has vaccinated only 5.5% of the population. That's fully vaccinated, 5.5% of our population. Contrast this to 51% of the population that has been fully vaccinated in the UK, as opposed to 47% of the population that's fully been vaccinated in the US. Dr. Aviral Vats, a physician with the NHS in Scotland, is also joining us. It's also getting a global perspective. We know that there have been warnings about the Delta variant. The World Health Organization has said that this is going to dominate across 111 countries. And the European Medicine Agency has said that the pace of vaccination needs to pick up because you need double vaccine to protect you against the Delta variant. How worried are you when you look at what's happening in India, where the R factor is rising, but our rate of vaccination is still 5.5%? If you look at that as the double vaccinated population.
Thank you very much for having me, Rishika ji. Indeed, I am quite concerned about all the parameters that you mentioned. Largely because even if I look at the scenario here in UK, despite huge numbers of vaccinations already been delivered, as you mentioned, the data of 55%, which has crossed beyond 60% when I was checking it last night. Despite that, we have an increased surge in cases. Now, the good thing about this data coming from UK is that it is only with the double doses that we are able to prevent the hospitalization or the severity of the disease. So that link between infection and hospitalization and death has definitely been weakened by vaccination. That too, double doses. Single doses are a lot less efficacious. They are better than no doses, but still double doses are the best. Now, considering that, when we look at scenario in India, as you mentioned, the COVID appropriate behavior is not really seen as much as we would like to. The vaccination pace is not as great as you mentioned. Only less than 6% have been vaccinated, and the variants, we don't know where the next variant is coming from because the transmission has not stopped. If we look at data coming from Africa, for example, it's a huge continent, over 1 billion people there. And the Delta variant is dominant there and it is spreading like anything. I mean, if you consider the first wave and if you consider it now, the cases, the deaths are way higher, which also means that there's a high likelihood of new variants coming from there. And we know a new variant generating anywhere in the world is bound to spread around. So, combining all these things, I am hugely concerned that India is more or less, we are unfortunately like a sitting duck, that we have huge number of population which has not been vaccinated. Remember, we have to get 2 doses for Delta variant. I don't know what the new variant challenges, what kind of challenges it's going to pose.
Yes.
And just a last sentence, sorry, is that we are only talking in the context of deaths. or hospitalizations. What we are not talking about is long COVID, which we are now in UK, but long COVID is another huge burden on healthcare, on people, on the economy, which also needs to be considered.
That's a whole different conversation about long COVID that we need to have. But Dr. Chandrakant Dharia, if I can bring you back into the conversation, with what the World Health Organization has said in terms of the dominance of the Delta variant, we know it's more transmissible. You have the European Medicine Agency saying mix vaccines if you have to, but double vaccinate your people because that gives them better protection. India with 5.5%, are we really at a disadvantage when it comes to dealing with the third wave?
So the ideal would be giving everybody 2 shots. But we know we are not living in an ideal world. We are not having that kind of vaccine supply which some of the countries such as UK and United States.
All right, we seem to have lost that line with Dr. Laharia. Dr. Jailal, if I can bring you in here on the same point of preparation, knowing all of this, knowing that we've only double vaccinated 5.5% of our population, are we really prepared?
No, definitely not. And we only know that how to get prepared, but still we are very slow to getting prepared. So when definitely after logistic, when we are looking on the augmentation of the vaccine production will take time, and it is not going to be possible for us within another 1 or 2 months to reach out to all the people. So only way that we have to make is containment and appropriate COVID appropriate behaviors, and we have to again and again press on that. Especially we are seeing the revenge tourism which is taking place in the northeast. Now the cases are now started wherever there is a zero negativity or the prevalence is less, that we are seeing the more cases are coming in that area. So we need to be extremely cautious, and infrastructure wise and manpower, I think the government is well prepared. Now even number of the cases are coming, we have bed strength is there, drugs are there, manpower is there. But preventive side, we need to work more on to prevent the cases to come from the hospital.
Dr. Laharia, we lost that line with you. Do complete your point.
So the point is that India is at very different stage of vaccination than United States or United Kingdom are. So our immediate priority, at least half of the target population is vaccinated with at least single shot. We should be focusing upon administering single shot to as many people as possible. And then we should be offering the second shot, of course, because the purpose at this stage in India is to reduce the hospitalization and mortality no matter which variant emerge. I also want to flag here another thing. Because India had already faced this Delta variant, which caused the second wave across the country, it is very unlikely epidemiologically and scientifically that same variant would cause the next wave in the country. Because the emergence of new variant and other kind of variant can cause the next wave, but same variant is unlikely to cause, because when individuals are infected by that variant, it is very likely that they would have some immunity. So our immediate focus should be giving one shot to at least as many people as possible. And once we cross 50%, then we go for second shot.
But when you're saying that it's unlikely that the Delta variant would trigger the third wave in India, what then would? Because what we're hearing, whether it's from global experts or experts here in India so far, is that the Delta variant is the biggest cause of concern.
So in any population where individuals are infected with a particular variant, the population is likely to have immunity to that particular variant. So since India had a second wave which was caused by variant, so people who are infected, and the estimates are around 60 to 70% of Indian population would have been exposed to Delta variant and developed some form of immunity. So the same variant cannot cause the next wave. But we need to remember there are still 30 to 40% of population which is unprotected. They have not received vaccine and other vaccines, so they can still cause get infection due to Delta, but unlikely to be that severe or as big as in other setups, because those setups are new to Delta variant. Other countries outside.
Dr. Vats, I want to bring you in here, because even the UK said that we are going to see a huge spike in cases, but they are not going to go back into the kind of lockdown that the UK has seen all this while. In India also, despite the warning signs, the red alert about the third wave that's been issued, one isn't seeing any kind of containment measures. But the stark difference here is that the UK has more than 50% of its population double vaccinated and India only has 5%. Is India's strategy correct?
I think even UK's strategy is a bit controversial. Independent scientific world are repeatedly suggesting the government not to unlock down, so quickly when we are only a few weeks away, to be honest, for like 4 to 8 weeks away from achieving that magical 70-80% magical number of double dose vaccination. Again, that is from the point of view that let's not expose our youngsters or 18 plus population either to the effects of long COVID, even if death is not that big a problem. Now, considering India, as my peer was mentioning, that variants, Delta variant might provide infection from Delta variant in the recent wave might provide some protection, but we don't know which variants are already circulating because genomic sequencing is not going at that rapid speed. So there might be some variants which are already spreading, and it's only a matter of time, because by the time we detect it in a certain number, it's already too late. So that is one point. So I think, again, coming back to the point of vaccination, there is the preventative measures. If we cannot upscale the dosage of, for example, vaccinations, we can definitely upscale the production of N95 masks.
Yes.
And just distribute them and create an atmosphere that they should be used very, very regularly because they're very effective.
Okay. I think it's important to remember that only 5.5% of India's population has been double vaccinated. At the moment, there are all the telltale signs of the inevitability of a third wave of COVID, and therefore, I think it all boils down to what you can do yourself to save yourself, which is, of course, mask up and, follow COVID appropriate behavior. I think that's really what it boils down to, at least here in India at the moment. Thank you all very much for joining us on this very important conversation. We'll, of course, keep a close watch on those numbers and the kind of measures that are being taken to prevent a third wave, given that we know it's coming. We're going to step into a very short break. We're up next. Dr. Chandrakant Lahiriya will continue to be live with us as we answer your questions on the coronavirus vaccine. Stay with us. Welcome back to our special campaign, Vaccinate India, in partnership with Google. We're discussing questions that you may be Googling about the COVID-19 vaccine, and Dr. Chandrakant Lahiriya, epidemiologist and health system specialist, is with us on the broadcast to answer those questions. Dr. Lahiriya, how do mRNA vaccines work? This is, a very commonly asked question, especially now that the Moderna vaccine has been given emergency use authorization here in India.
So mRNA vaccines contain the genomic sequencing from spike protein of coronavirus. These are the antigenic portion in spike protein which can go inside our cell and formulate a protein there. Those proteins appears on the cell surface of human beings, and then our body form the antibody against those spike proteins. So that way our body is trained to identify when a natural infection happens. So mRNA vaccines train our body to formulate antibody without making us sick. So once person develop a natural infection, the antibodies are already there and we are protected from developing the disease.
And are mRNA vaccines better than the viral vector, the adenovirus vaccines, which is what we're using here in India right now?
It is simply a different platform. We cannot compare vaccines on different platforms from one to other. We know that in COVID-19 pandemic, there are a number of vaccines which have been used or developed through a platform on which no vaccine was developed in the past. So mRNA vaccines from Moderna and Pfizer-BioNTech are the vaccine on that platform for the first time for human beings. Though these platforms have been used to develop vaccine for the first time, but they were under research for last 25 years. So the research was going on, vaccines have been successful for the first time. Similarly, the viral vector vaccines such as Covishield, which is there in India, and Sputnik V have been developed on a completely new platform. On these platforms, no vaccine was developed in the past. Covaxin is an inactivated vaccine, and now inactivated vaccine platform has been there for long. So these three are different platforms, but we cannot say that which one is better or which one is inferior. We know that efficacy of these vaccines range from 80% to 95%.
All right. And 80% to 95%, of course, is considered very good in terms of giving you protection, at least from severe COVID. But, the other important question is about antibodies. Now, a lot of people are very new to the phenomena of antibodies. This is only being talked about after the COVID-19 pandemic. Does the presence of antibodies mean that you are protected and immune from COVID-19?
So we are still developing a better understanding of immune protection from COVID-19 disease. However, we know that if somebody who has been vaccinated or developed a natural infection, and then if that person develop antibody, he or she is most likely to be protected.
Okay.
Alongside, we really do not know that how much quantity of antibody one need to have before the person can be considered protected. So for the time being, it is considered that a person has a particular threshold which vary from one particular testing method to another method, usually 1 or 10. If somebody has antibody level more than that, it is considered that person is protected. Now, I also want to flag that, for example, cutoff is 10. And if somebody has 40 on that and other person has 400 on that parameter, that does not make any difference. Both individuals are protected at the similar level. All you need to have protection is the amount of antibody present or seroconversion.
And what if you don't have antibodies? Does that mean that you're not protected?
As of now, we really do not know that if person has not developed antibody, what would happen to that person. But we also know that antibody is only one of the marker of protection after vaccination. There are T cell based response of protection which is also provided. So it is very much possible that if somebody who has not developed antibody, that person might be protected from T cell based response. So when somebody who has received both shots of vaccine, if the person has not developed antibody, the person need not to worry. We are still developing a better understanding of protection, and maybe in the time ahead we would know a little better.
Well, that's an important clarification, because a lot of people who are getting double vaccinated are going to get their antibodies tested, and then when they don't have enough antibodies or their antibody report isn't very good, they're very disheartened and they tend to believe that the vaccine doesn't work. So that's a myth.
Yes, that's a myth. They did not to do anything. It is. We really do not know, but it is also possible that even they are protected. But some people who do not develop antibody after 2 shots start thinking, should I get another vaccine, another shot, or different vaccine? Not currently recommended. They should not think of that. They should simply stop there, that they might be protected even without the antibody. In any case, whether you develop antibody or not, you need to keep following COVID appropriate behavior.
Absolutely. Well, thanks so much, Dr. Lahiriya, for joining us and answering all of those questions.